I'm Dr. Desiree D'Angelo. I work at Premier Surgical Network and I am a general and breast surgeon. So Premier Surgical Network is mainly general and breast surgery. We have some physicians that are fellowship trained and do only breast surgery, and then there's other ones that have had a focus in breast surgery for a long time and then also do general surgery procedures like hernias, gallbladders, appendix, skin cancers, and other things like that. At Premier Surgical Network, we have a team of nurses and other staff to help the patients get through their appointment quickly and easily. We have staff at the front desk to help them check in. We also have patient coordinators that help with the paperwork and the portal that we're working on. And then we have our own MAs or nurses that help room the patient and help follow up with the patient. And then we all have our own schedulers to help us schedule the procedures. We also have a nurse navigator in the office that helps navigate the breast cancer patients through all their appointments. So when you come to our practice, I feel like there's a more personalized experience, not just like a cog in a wheel. We really take the time to look at each patient individually, get to know you. We can pay that closer attention to you, whereas in a bigger university, you may get lost in the shuffle a little bit. We have all been in practice here for a long time. We have a lot of really good relationships with other referring doctors. We all keep in touch. We can text each other, phone calls, so the patients can be reassured that your doctors are made aware of what's happening. I'm most proud of being part of Premier Surgical Network in the way that we get to care for patients. I feel like because we are a private practice, there's not a lot of bureaucracy around what we have to do, where we have to follow certain rules that maybe a bigger institution forces you to have to do XYZ. We sort of have complete autonomy with our patients, and they let us care for them the best way we see fit. Also, it's just a nice place to work. They give us beautiful office space, they give us wonderful staff to make the patients comfortable, and it just makes it very easy for us to take good care of our patients. I think a patient who wants to come to see us should, definitely make that call. Even if, I've seen patients who ask about second opinions and should I go to see a second opinion. I always encourage patients to get as many opinions as you feel comfortable with. But at least, usually in our office, we can get you in very quickly. We always kind of save some space for emergencies or really important things that need to be seen right away. So, whereas somewhere else you may have to wait a month for an appointment. We try to make our practice as accessible for patients as possible. So